Hi there, Doc J Zimmerman here. We are going to be starting a pregnancy and chiropractic prenatal care video series. We're going to walk you through how we take care of our pregnant patients and why that we're specialists and one of the few chiropractic obstetric specialists in the county. So the video series will be filming some of our patients getting adjusted, so you get to see how it is that we care for them. And just so you know, we have special equipment so that pregnant women are comfortable in our office. These tables that you lie on to get your spine adjusted, this piece pops up so that the pregnant woman's belly can hang over the edge and they can actually lay on their stomach. And a lot of our pregnant patients will tell you that this just coming to lay on their stomach is worth the whole visit. So we have special tables. And as you'll see in a moment, we have special techniques for pregnancy. So we will move right to that next. Okay, we're recording. Hey there, it's Doc J Zimmerman here, and today we're going to demonstrate our pregnancy care, our prenatal chiropractic. We have a happy volunteer laying here who happens to be 39 weeks pregnant, so you can see that we can take you right full term. And the whole main purpose of chiropractic and pregnancy prenatal care is our focus is on the pelvis. We want to make sure the pelvis is centered. If the pelvis has fixated joints, meaning they're stuck on one on either side, and there's a misalignment there, it's going to affect not only the opening where the baby comes out, and you want that opening to be wide and clear so there's an easy exit, but it's also going to cause tension and stress on the round ligaments in the front of the abdomen, which support the uterus. And if there's tension on the round ligaments, then it's going to narrow the space in the uterus that the baby has to move. It's going to cause a uterine constraint, and that could sometimes prevent the baby from going head down, and the baby will be in a breech position. So chiropractically speaking, we got our main priority is get the pelvis centered, and then relax the round ligament so the baby can move. And then along the way, as we're doing this, we're adjusting spinal joints and taking pressure off the nerves to the reproductive organs, which is vitally important for the development of the baby. So what we're going to do right now is some reflex tests to figure out, and I already know this from taking care of this young lady for all this pregnancy, but where the joints are stuck. But I'll show you what we're going to do is I'll press on here, then I'm going to look for occipital muscle tension up at the space of the skull, and when I get that occipital muscle tension, it shows me what joint's out of alignment. So right now we're showing left sacroiliac joint and left ischium, the left ischial tuberosity. So we're going to lift this table up. Now all the techniques that we do for pregnancy are designed for the safety of the mother and the safety of the unborn child. So they're all pregnancy certified techniques, and they're, as I said, it's designed for the patient's comfort and the safety of the baby. So we're going to get the joint to move by pressing with my arm here. Now this piece popped up and it's going to make a loud noise, but the patient's not going to feel that. And my momentum of my arm pushing the table down is what causes the joint to center into the right position. So we do that, it makes a nice push. We're going to do that 3 times. Boom, like that. And then we're going to press down on her ischial tuberosity like this. Now, in old school chiropractic, we would adjust this joint by putting the patient on their side and then twisting and bending and pushing, but you can't do that on a pregnant woman because it puts too much torque on the uterus. So again, you want to do everything that's safe and nothing that's contraindicated. So we're going to do a more drop on her sacrum to get it centered, and that looks pretty good. So what we're going to do now is we're going to come up here and free some fixations up in her upper back. What's going to happen is during pregnancy, most of the stress is down here on the lower back and pelvis, and then once the baby is born, then the stress shifts to up here in the shoulders because now you're feeding the baby and your head's bent forward and you're sort of slouched over in a C position. All right, so what we're going to do now is we're going to work on the round ligaments. So we're going to get you to flip over and come back. That's it. Okay, put you on your back. Good. So how we find the round ligaments is we find the umbilical area, the belly button, and we go to the top of the iliac crest, and I draw an imaginary line, and when my fingers intersect, that's the point of round ligament tension. So very gently with my thumb, I'll place it on the round ligament, and we'll sort of press towards the opposite shoulder, and we'll hold that for about 20 seconds or so. And this will relax everything in there. And we already know that this baby's head down, and the baby's been head down. And I wouldn't expect or have it any other way since we've been taking care of you for a while now. Almost the whole pregnancy, almost. All right, so now we're going to switch the other side. And we're going to go like this and press in. And then a lot of times now, especially at 39 weeks, you're feeling the baby parts down here too at the round ligament. That's good. So the other important part of prenatal pregnancy care is the front of the pelvis. The pelvis is, it has two big sides to it, one on the right, one on the left, but it joins from the back to the front. And the front is the opening where the baby comes out of. That's the pubic symphysis, opens up for the baby, and then the pubic bone. So you have to make sure the pubic bone is aligned properly so the baby has room to get out. So we find the pubic bone and we take this adjusting instrument and very gently we tap down. We do the same thing there. This one's a little on the higher side, so we press down a little longer. Now, because we're also concerned about her overall health, we're checking the whole spine, and we're going to adjust her neck a little bit. We're going to turn and give a little push. Good. And then push. Good. And then that's good. So now we're going to do one last adjustment. So when we're taking care of pregnancy and all the months leading up to the 40 weeks, as the belly's growing, the weight's pulling forward on the spine, so you have to have a way to release that stress and tension. You do it not by adjusting from the back forward, but adjusting from forward backward. So we're going to go like this. Then you're going to come back, you're going to lay on my hand, I'm going to give you a big squeeze, and then we're going to adjust. You can lay still there, all right? So now we're just going to double check, make sure the leg length is where we want it, and that's it. That's our pregnancy adjustment. I probably won't see you next week because you better have a baby, all right? All right, let me shut this video off.
Yeah, he just